Hello, I'm Cathy Malone, Program Officer at Robert Wood Johnson Foundation. Welcome to our celebration of the winners of the 2020 RWJF Award for Health Equity. We are thrilled that you are here with us today as we recognize 11 individuals who in their communities and throughout the country undertake the difficult work of systems change to advance health equity. The award winners we celebrate today are committed to making health systems more relevant and accessible. They are committed to giving those within their communities who are vulnerable and underserved a fair and just opportunity for health and well-being. I believe that you will find their stories compelling, their work to be game-changing, and how they approach systems change to be inspiring and encouraging to all of us. I am pleased to say that the RWJF Award for Health Equity is now in its 5th year, and I am very proud to say that we are now 54 award winners strong. At Robert Wood Johnson Foundation, we believe that regardless of class, race, ethnicity, financial means, or life circumstances, everyone should have a fair and just opportunity to be healthier. We, along with thousands of others, have embarked on an ambitious goal to build a culture of health. Building a culture of health is not just an aspiration, it is our conviction. We invite all those who are committed to increasing health equity to join us in this movement. In a few minutes, we will introduce you to the 2020 award winners and tell you their stories. Before that, however, I want to tell you a little more about the grantee organizations, our partners, that bring this award program to life, and also let you know that later in our program, we will hear from Avenel Joseph, RWJF's Vice President of Policy, who will share with us her thoughts on the urgent need for systems change at this moment in time. Also with us today is Joe Costello, RWJF's Director of Digital Communications, who will be joining me in presenting the awards. 9 national organizations that are aligned with our mission to build a culture of health and increase health equity are critical to the success of this program. Each year, they identify those courageous leaders and systems changers within their network to receive the Award for Health Equity. Our thanks go to AIDS United, whose mission is to end the HIV epidemic in the United States. The Asian and Pacific Islander Caucus for Public Health, who is the vision and voice of public health and health equity for Asian and Pacific Islanders. Community Campus Partnerships for Health, who promotes health equity and social justice through partnerships between communities and academic institutions. Hispanics in Philanthropy, who works to strengthen Latino equity, leadership, and voice. Leading Age, who seeks to be the trusted voice of aging. The National Association of Free and Charitable Clinics, whose mission is to solely focus on the needs of the medically underserved. The National Civic League, who advances civic engagement to create equitable, thriving communities. The National Recreation and Park Association, who is dedicated to building strong, vibrant, and resilient communities through the power of parks and recreation. And Youth Move National, who is devoted to improving services and systems for youth and young adults. We are extremely grateful to the Award for Health Equity grantees for their commitment to health equity and the success of this program. It gives us great honor to recognize the 2020 award winners. These 11 individuals bring true meaning to the intent of the award, to use the tools of systems change to increase health equity. Let's now meet the award winners and learn about the opportunities they saw, the challenges they met, and how their commitment to systems change moved their communities closer to health equity. Joe, please tell us about D. Rashaan Gilmore.
Thank you, Cathy. Some of the most effective healthcare solutions come from the people closest to the problem. When it comes to developing community-informed solutions for Black queer people, certain barriers often get in the way. There must be advocacy for the community and active engagement of the community. Rashaan Gilmore is founder of Blackout Incorporated, based in Kansas City, Missouri. The organization is about providing access to safe spaces and sufficient resources to help members of the community thrive. As Blackout's founder, Rashaan is dedicated to community autonomy, community sustainability, and Indigenous community leadership. Blackout's vision is driven by systems change. Blackout worked with trusted partners to bring COVID-19 testing to the community and extend Blackout's HIV work. They pioneered telehealth well before it became widely adopted by healthcare providers. Inspired by the voguing documentary Paris is Burning, within the community, the annual Blackout-sponsored ball has become the event of the year, attended by hundreds within the community. At these highly popular events, Blackout disseminates health information and uses testing as incentive for free admission. With university partners, Blackout conducted a community survey producing 116 strategies recommended by members of the Black LGBTQ community. These recommendations led to the creation of a model of care tailored specifically to the needs of Black LGBTQ people in Kansas City. The model combined mental health care, PrEP access, provider trainings, and 24-hour access to providers, among other critical linkages. Rashaan Gilmore, your work has been transformative. Thank you for helping us to see that increasing health equity is about community engagement, ownership, and empowerment. On behalf of AIDS United and all of us at the Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity. Cathy, please tell us about Susie Milano.
Patients with limited English proficiency need healthcare interpreters who are highly skilled, well-trained, and considered to be valuable members of the medical team. If there are no professional standards for healthcare interpretation, then patients will be at risk for unequal access to quality care. Susie Milano believes that by increasing standards, status, and work opportunities for healthcare interpreters, we increase health equity and reduce health disparities. This is especially true for immigrants, refugees, and those who seek asylum. When it comes to healthcare interpreters, Susie is dedicated to systems change. Susie founded the Oregon Healthcare Interpreters Association. Her work is vital to the limited English proficiency communities and safeguards equal access to quality healthcare. She brings together partners to strengthen performance and consistency in the field of healthcare interpreting, and to improve economic opportunity and quality of life for interpreters. Susie created a program in which experienced healthcare interpreters mentor trainees from a vast array of language groups. The association sponsors research that examines specific problems affecting medical interpretation. Under Susie's leadership, the Oregon Healthcare Interpreters Association is working with the state legislature to create an interpreting licensing board to ensure that all interpreters, interpreting agencies, and healthcare providers uphold statutory standards. Susie, thank you for your tireless work and effective advocacy for patients and interpreters moving towards a more inclusive healthcare team. On behalf of the Asian and Pacific Islander Caucus for Public Health and all of us at Robert Wood Johnson Foundation, congratulations on your 2020 RWJF Award for Health Equity. Tell us about our next award winners.
Native Hawaiians had to assimilate to Western lifestyles and systems and were forced to abandon most of their cultural practices. There's also a long history of unethical and exploitative research conducted on Native Hawaiians. Today, Native Hawaiians experience pervasive health and social disparities. To strengthen the health of the community, the Native Hawaiian community of Waimānalo embraces their cultural and sacred practices and engages as an equal partner in the research and programming that impacts their community. Ilima Ho Lastomosa and Dr. Jane Chung-Do partner to promote local community empowerment and self-determination. As a result of their effort, there has been a rebalancing of the power structure in academic research. The community has voice, influence, partnership, and ownership on matters of research involving their community. This is a fundamental shift and is the work of systems change. Ilima Ho Lastomosa is a community leader and Native Hawaiian cultural practitioner. Dr. Jane Chung-Do is a public health professor and researcher. They founded the Waimānalo Pono Research Hui, an association that is composed of over 50 academic researchers and community members and addresses priorities identified by the community. During the COVID-19 pandemic, they distributed 24,000 prepared meals, 3,550 fresh produce boxes and seeds and plant starters, with a focus on Hawaiian traditional food staples. Ilima and Jane support food independence through the alignment of technology and Hawaiian cultural values. They are a strong proponent of modern aquaponics based on traditional Hawaiian agricultural and fishery practices. Ilima and Jane, thank you for your work in reducing health disparities by honoring Native cultural practices and fostering a respectful model of research that empowers Native communities. On behalf of the Community Campus Partnerships for Health and the Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity. Cathy, why don't you tell us about our next winner, Alex Sanchez?
Strategies that lead to a better future for disenfranchised youth and families must make a difference in both the streets and the homes of the community. This is the case for youth and families in Central American communities of Los Angeles. For this community, the work of health equity is the work of constructing strong, healthy, and empowered communities and advocating for social justice. Alex Sanchez believes in a holistic approach to violence prevention. Alex is compelled to re-examine the systems to better support healthy and safe spaces for disenfranchised youth and their families. His approach is that of systems change. Having overcome his own history of gang-involved youth, incarceration, and deportation, Alex ultimately found purpose as an advocate for change. He is the executive director and co-founder of Homies Unidos. Alex is a strong and influential advocate for racial tolerance and cultural understanding, immigration and criminal justice reform, and Black and Brown unity. Homies Unidos is a nonprofit that works to end violence and promote peace in Central American communities. When COVID-19 broke out, Alex designed the Community Response Initiative. This unprecedented food distribution model helped to broker cooperation between rival gangs who distributed food together. Food relief with peacemaking, reduced violence, and improved community solidarity. Other changes grew from this initiative. These changes led to 3,000 people participating in the census and a significant voter registration drive. Alex's Black and Brown Breaking Bread campaign supports conversations between different groups as a means of brokering peace, empowering youth, and strengthening the community. Alex, your work of developing inter-community trust is helping to build a new model of community health and health equity. On behalf of Hispanics in Philanthropy and the Robert Wood Johnson Foundation, we congratulate you on your 2020 Award for Health Equity. Let's hear about our next award winner, Linda Coleman.
Quality of life for lower-income older adults and people with disabilities is greatly improved when they have easy access to health and social services. With these services at their doorstep incorporated into their housing experience, seniors can better address their needs, pursue independence, and stay involved with the community. Linda Coleman created a culture of well-being for the residents within the Human Good affordable housing community. At Human Good, seniors receive these enhanced services regardless of insurance status or economic level. Through systems change, Linda has re-engineered the senior living experience to advance health equity. Linda Coleman is Vice President of Resident Services at Human Good. Human Good provides housing and services to approximately 8,000 residents in 96 affordable housing communities across California, Delaware, Pennsylvania, Oregon, and Washington. Partnering with San Francisco State University, Linda brought nursing students to human good communities. Linda partnered with the health plan of San Mateo to set aside apartments for older adults. This made independent living available to individuals who may have otherwise required institutional care. To increase access to health services, Linda brokered a partnership with the Inland Empire Health Plan. This partnership provided healthcare navigators to the residents in human good affordable housing communities. With Linda's encouragement, human good resident service coordinators now serve on municipal and county commissions and committees. Linda, thank you for your leadership in changing systems and policies to help lower-income seniors have a fair and just opportunity to live the healthiest life possible. On behalf of Leading Age and the Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity. Cathy, tell us about our next winner, Dr. Maurice Lee.
Having to navigate a health system riddled with gaps and barriers can be particularly challenging for those who are vulnerable and uninsured. These are among the conditions where health can deteriorate, illnesses can go untreated, and chronic conditions can become acute. Increasing health equity for vulnerable populations is the work of closing the gaps and dismantling the barriers and replacing these obstacles with greater access, better and timely services, and high-quality health care. Dr. Maurice Lee recognized that the system that serves the 40,000 uninsured people of the Phoenix metro area was in need of a systems change. Maurice formed the Arizona Safety Net in collaboration with more than 40 primary care clinics and specialty providers. Maurice's work of systems change was a major first step for health equity for Arizona's uninsured. The Arizona Safety Net exemplifies an efficient and effective system with improved patient outcomes. It eliminates long waiting lists and delayed diagnostic testing. The changes that Maurice ushered in enhance completion of basic diabetic retinopathy screening that exceeds the national average for both insured and uninsured patients. Organizations that once competed with each other now collaborate, sharing resources and best practices. The Arizona Safety Net Resource Index helps ensure the same standard of care for uninsured patients as for those with insurance. Arizona Safety Net's results are highlighted by improved access to services, higher quality of care, and decreases in emergency room utilization and hospitalizations. Maurice, thank you for your unwavering belief in the rights and dignity of all patients and inspiring others to join you in this incredible endeavor. On behalf of the National Association of Free and Charitable Clinics and all of us here at Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity. Let's hear about our next awardee, Dr. Wu.
Systemic barriers, language, and cultural differences contribute to health disparities. The myth of the model minority has deepened this gap. These elements shape health experiences of many Asian Americans. To increase health equity within the Asian American community, we must see the health disparities, understand the data, and address the factors contributing to inequities. Dr. Soo Yinwoo has observed the complex barriers to good health impacting Asian Americans. As a nurse and health services researcher, Dr. Wu works to change the way traditional health systems deliver care to vulnerable populations of Asian Americans in Michigan. She has tirelessly worked to inform health systems and legislators, engage the community, and make health equity for Asian Americans in Michigan an urgent priority. Dr. Wu is the professor and director of the Eastern Michigan University School of Nursing PhD program and Center for Health Disparities, Innovations, and Studies. Her peer-reviewed publications bridge the gap where data were largely lacking on health outcomes of Asian Americans and Asian refugees. A chief advocate, Dr. Wu works to ensure that Asian American voices are heard by health authorities, legislators, and scientific societies. The Patient Navigator program enabled several thousand Asian Americans to obtain quality health care and engage in preventative health programs. The interventions have reduced disparities in cancer, chronic disease, mental health, and lead poisoning prevention. Dr. Wu, we deeply appreciate your advocacy, diligence, and scholarship, ensuring that the issues facing the Asian American community are known, understood, and addressed. Thank you for your leadership. On behalf of the National Civic League and the Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity. Cathy, please tell us about Zernial and Daryl Quarles.
It can be extraordinarily challenging for older persons with limited incomes to find a safe and inspiring place to engage in health-promoting activities. Zernial and Daryl D. Quarles believed that older persons need a highly desirable, health-promoting destination, a place that would be accessible, attractive, affordable, and affirming. This belief was grounded in systems change. They worked with community leaders, neighborhood associations, and a developer to create the WellMed Charitable Foundation Senior Activity Center at Redbird Square. More than just a serviceable, adequate place for older persons to gather, the center is a 22,000 square foot state-of-the-art facility where seniors can engage with their community in new and healthy ways. Carol is the executive director of the WellMed Charitable Foundation. Daryl is the senior program division service area manager of the Dallas Park and Recreation Department. Their joint efforts illustrate the power of public and private partnerships. The center features workout facilities, fitness classes, and a personal trainer. There is a dining room, demonstration kitchen, computer lab, movie theater, and a full slate of educational and fun activities. There's even a next-door primary care clinic. Their accomplishment demonstrates that full amenities and high-quality services, typically found only in affluent areas, can promote new health behaviors in seniors with lower incomes and help the community achieve greater health equity. The center exceeded its goal and has now registered more than 3,100 older persons and 10,000 involved in the senior program through the Dallas Park and Recreation System. Daryl and Carol, thank you for your work which invigorates the older adults in the Oak Cliff community and proves what can be created through visionary collaboration, advocacy, and belief. On behalf of the National Recreation and Park Association and the Robert Wood Johnson Foundation, congratulations on winning the 2020 RWJF Award for Health Equity. Let's hear about our next awardee, Te Jay McGrath.
When we look closely at the lives of youth and young adults who are homeless and vulnerable, we see that they need basic resources to maintain dignity in their daily lives, protection from domestic and street violence, and life skills training. For many within the LGBTQ+ community and Black and Brown young people, the COVID-19 pandemic made their needs greater and their life conditions even worse. Te Jay McGrath saw these needs and seized the opportunity to bring about systems change for underserved youth. His innovative, integrated, and customized approach connected young people to community supports and resources and connected the social system serving them. The City of Pasadena Public Health Department maintains the Transitional Age Youth Link Program, TAY. The program helps young adults 18 to 24 who are homeless or at risk of homelessness. The TAY Link program offers job skills and life skills training, as well as benefits such as mobile HIV testing, flu shots, groceries, hygiene kits, information on COVID-19, and meals from Pasadena restaurants. As the TAY program coordinator, Te Jay helps young people effectively respond to the pressures of their lives and those generated by the pandemic. Addressing a critical housing solution, Te Jay has brought together a variety of community resources. He has organized specific responses, such as a temporary motel program. He has introduced simple and practical services, such as a mobile shower program to support the health and well-being of homeless young adults. Local businesses struggling with COVID have benefited from Tailing's purchases of their services, a holistic approach that helps the larger community. TJ, thank you for your dedication to helping youth come through a crisis to a better future. Your innovative solutions improve the health of Pasadena youth and the well-being of the entire community. On behalf of Youth Move National and the Robert Wood Johnson Foundation, congratulations on your 2020 Award for Health Equity.
Thank you to all of our 2020 award winners. You show us that systems change is the work of building and dismantling, bridging and disrupting, instructing and empowering, and being a champion and a partner. And now, Robert Wood Johnson Foundation Vice President for Policy, Avenel Joseph.
I am honored to be with you today to congratulate all of the 2020 award winners of the Robert Wood Johnson Foundation Award for Health Equity. And thanks to all of our viewers for joining us in this celebration. There is no better moment to show our deep appreciation to our award winners for their commitment to health equity and systems change. As we continue to battle a pandemic that causes disproportionate harm and suffering for people of color, particularly those in lower income communities, systems change to increase health equity is desperately needed. A strong evidence base confirms what many of us recognize intuitively. Multiple systems influence health and must be aligned to improve lives. Only action will place us on a path toward true racial justice. RWJF is committed to challenging systemic barriers and surfacing the types of solutions that will remake the United States in the name of health equity. The award winners' work of systems change is the work of course correction. They are using all the resources and options available to them to reverse the downward spiral of health inequity and disparities for the underserved. And their work is amazing. Their work shows us that opportunities for systems change appear in the challenges we decide to take on and the risks we are willing to accept. They show us that change can occur through the questions we ask, the spaces we make for new seats at the table, the barriers we are willing to tear down, and finally, by listening to voices of those who are often ignored or marginalized. Sometimes the seeds for innovation come in small packages that present themselves in seemingly minute ways. Let's take a look at a few of our past award winners.
There's so much more to health, and that trust matters, that relationships matter, that life experiences like, childcare and transportation and housing matter more to health than just prescribing medications or an MRI. So the workforce is changing as well. Before, we used to only look for the letters behind somebody's name in order to see if somebody was qualified to deliver health. Now we're realizing, particularly with impact and with our work with community health workers, that altruism, empathy, listening skills, being a non-judgmental person, that matters a lot to patients and it matters to outcomes.
What I didn't realize is how many of our patients do have smartphones. And we would try to call them about appointments and different things, but now we can text message them, and our no-show rates are down. Within 48 hours, I filled up the entire vaccine clinic with just sending out a text message. Patients who had so much trouble getting there, and you'd say, why don't you have control of your blood pressure? Well, it was because of the issue of transportation. We've been able to try to make an innovative program like Zoom to make it happen.
We know that 1 out of 10 Asian Americans is living with chronic hepatitis B infection. We see significant rates of tuberculosis among certain communities, and we also see significant rates of obesity and cardiovascular disease in specific Asian communities. And so it's only through unpacking the data and disaggregating it by racial, ethnic, country of origin group for Asian Americans, Native Hawaiians, and Pacific Islanders that we're often able to have a fuller understanding of the health epidemics and disparities that exist in our communities.
the piece that is really important to us also, just as much as the healthcare in providing really great outcomes, is to make sure that people are moving up that economic ladder.
One of the things that we're trying out that in this case worked really well is applying something called co-design. So the idea of co-design is we're not trying to take a model that somebody has evaluated somewhere else and coming into this system and saying, look, this was evaluated somewhere else, so you better do it because it's going to make your system better. Rather, we come in and we recognize that every system, every local culture, every organization is totally unique in the resources that it has and the skills people within that organization have and the way people communicate, talk to each other. Everything about that is only applicable to that system. So when you're coming in to try to do programming, you have to do it tailored to what the strengths and the needs are of that system.
Serving lower income communities, we've learned to take the services to them. Though we have beautiful parks and facilities and programs and events, if they can't access any of those opportunities for whatever reason, you must redirect your service approach and go directly to them.
We realized we had a 1 to 2 year waiting list, and we felt there were a lot of people in the community that needed the services that we provided. And so we decided that the next thing to do would be to do an outreach program, and so that was Kavod on the Road. And that was an effort to look at the same kind of seniors that were coming into us, and before they got into living in our apartments, start to provide them with some wraparound services.
I think being an advocate for any given group of people entails making it a part of your daily life, you know, in any work that you do, and always having that advocate cap on.
We add name change, we add GED programs, because when you help a transgender and when you're trying to work on women's health, you have to work with the whole life of the transgender person. They don't have to go to get tests. The tests go to them.
In terms of improving health outcomes, what we at Kavod have noticed is through this twofold objective of reducing social isolation and increasing mental stimulation, we really are able to achieve our goals of enabling people to live and age in place in their community and be connected. The mental stimulation side is equally important in terms of quality of life, longevity of life. We know the research is out there that not only being engaged socially, how that benefits a person, but also the mental stimulation, how to keep the brain active.
Essentially what we wanted to do was a few things. One was partner with the research community. We felt like there was a big opportunity to work with the research community to operationalize adolescent brain development to probation practice. The other big thing we wanted to do was partner with families, parents, caretakers in a genuine way. Often our system demonized parents as the problem for young people being in the system. So we wanted to have a genuine partnership because we knew to accelerate our reform results, we need to have parents' voice at the table and go beyond the traditional cognitive behavioral approaches. We want about 70% of our young people to be served in the diversion field. We feel if we can reduce out-of-home placement and give more young people diversion opportunities, it's going to reduce or eliminate the racial and ethnic disparities in our system.
As we continue to build a culture of health, the award winners show us that systems change is achievable when we seize the opportunities, no matter how small, believe in the possibilities, no matter how bold, and step courageously into the work of increasing health equity. We are profoundly grateful to the 2020 award winners for their commitment to health equity within the communities they serve.
On behalf of all of us at the Robert Wood Johnson Foundation, thank you for joining us in our celebration and recognition of the 2020 winners of the RWJF Award for Health Equity. We are excited to tell you that each month we will be releasing an interview discussion with each of the 2020 award winners that were featured here today. Look for these on RWJF's YouTube channel. The interviews are a great opportunity to learn more about the award winners' work, challenges, and lessons learned. Thank you to our colleagues at the GOTA Group at Grayling for their work in bringing us this virtual event. We also invite you to learn more about the work of all the award winners by visiting the Robert Wood Johnson Foundation website. Thanks to you all.